Assalamu alaikum. Today our topic will be traditional versus electronic CBL. First of all, we should identify the definition of case-based learning. Case-based learning has the goal for students to prepare themselves for clinical practice through the use of authentic clinical cases. It links theory to practice through the application of knowledge to the cases using inquiry-based learning methods. To wrap up, case-based learning is the link between theory and practice. It aims to enable and empower students to apply their knowledge to deal with clinical scenarios, to be an expert doctors in the future. Then, what is the traditional case-based learning? CBL is an active learning and teaching, and this is important phrase. Active learning for the students and active teaching for the tutor, the facilitator. So we have a role for the students, and we have a very important role for the tutor. CBL involves a clinical case scenario or scenarios that developed to stimulate and reinforce the acquisition of knowledge, skills, and attitude for a topic. We use a scenario to stimulate learning, to motivate students, and so on. After that, self-directed learning by the students, as the tutor give the students learning objective and sometimes the scenario and the reading material to prepare themselves before they come back to make the discussion at the aligned time for the session. During the session, group discussion and teamwork will be done. Problem solving and critical thinking between students will be done, which is very important to create and establish communication skills and good preparation, work in teamwork, and so on. Number 5, active facilitation skills. It is the role of the medical teacher, role of the tutor, communication and professionalism. Then we have a model for the traditional CBL. Number 1, case scenario, and as we said, scenarios may be multiple scenarios, and reading material provided to students. Number 2, CBL group meet. So first of all, the tutor prepares the scenario, reading material, send it to students to prepare themselves for the meeting. Then CBL group meets, facilitator outline objectives and assign roles. Mainly assign the leader for the discussion of the students and the scriber for the discussion of the students, and maybe a timekeeper for this discussion. Then group discussion will start. The leader guides the discussion and the scriber will take notes. After that, participants discuss the case and the learning objectives with each other. Then we reach the area, or we reach the role of facilitator. Here, the role of facilitator to sum up the students' discussion. Then, student attempted quiz, and the results of quiz will be displayed to the students. So tutor prepares the scenario and the reading material and learning objectives and sends them to the students. Students prepare themselves before coming to the CBL session. Number three, during the session, they will discuss the learning objectives and different clinical data with each other. Number four, the facilitator will wrap up the discussion. Number five, quiz will be performed. Now, we will watch an interesting video illustrating the traditional CBL. What are the principles? How can we make CBL an interesting teaching and learning tool, and so on?
Hey Dan. Wow. There have been so many great instructional strategies presented at this trade fair.
Hi, Lindsay. I am glad you have been enjoying it.
Case-based learning. I have never heard of that. Can you tell me a little about it?
I would be happy to. Let's picture a typical classroom. Typical lectures provide students with the content they need to work in a given field. They are gambling that when their students go out into the real world, they will be able to figure out how to apply this information.
So how is case-based learning different?
Case-based learning brings the real world into the classroom in the form of a case. Cases are stories that highlight a specific learning objective. Students learn about real situations that they will need to apply their knowledge to, and that also helps them remember the content better.
Isn't this problem-based learning?
Great question. The two are very similar. Case-based learning, as the facilitator, provide learning objectives for the students, and the instructor helps to guide the students to those objectives. In problem-based learning, the students are the ones who determine their own objective while trying to solve a problem.
Can you give me a quick example of case-based learning so that I can wrap my head around it?
Okay. Say that you are teaching a lesson in medical school. You want to teach your students to differentiate between 3 respiratory diseases that have similar symptoms. You could lecture them about the disease, or you could use case-based learning and give them the case of Mary. Mary has been feeling short of breath for several days, with today being the worst. Her respiration sounds like a whistle when she breathes out, and she has a dry cough. The case about Mary could include her physical appearance, any blood work done, her medication list, and so on. The students will use this information to ask questions and eventually try and determine what is causing Mary's shortness of breath.
I get it. So instead of just talking about a disease, you tell a story about a person with that disease.
It sounds like you have got the basics down.
Hi Dan. I could not help but overhear your conversation. I was wondering, what are the key features of case-based learning?
No problem, Mike. As educators, we want to prepare our students as much as possible for their future careers. To do this, we need to promote the application of knowledge. This is a big strength of case-based learning. We tend to forget lists of PowerPoint presentations. Stories, however, stay with us. If you think back to the last PowerPoint presentation you saw, I am sure you cannot remember all of the details. But if you try to remember the details of the last movie you saw, I am sure that you can remember a lot about it. This is because people are very good at remembering stories. Before the invention of writing, stories were used to pass down information from generation to generation.
That is an excellent point. I have never thought of it like that. Is there any other features to case-based learning?
Case-based learning can also give students workable experience by showing them how an expert would handle a specific real-world situation. Another feature is that it is learner-centered. It forces students to make decisions and apply the knowledge that they have learned.
Are you not neglecting the course content by just telling stories in class?
The case is just to give the students a context. The real learning comes from the discussion around the case. Cases force the students to make decisions and discover their own answers.
Interesting. What are the intended learning goals for using case-based learning?
There are several. The first one is to promote the students' transition from novice to expert. By students developing higher order thinking skills and teamwork, they learn to think like an experienced practitioner. Case-based learning also promotes the awareness of multiple perspectives and solutions to any given problem. Students quickly learn that there are not always right or wrong answers. The last learning goal is to have students take more responsibility for their learning.
Which learning domains are addressed with this strategy?
Cognitive is the most obvious answer. Students need to problem solve, acquire knowledge, and apply supply information in order to answer questions around a case. Another domain that might not be immediately obvious is the affective domain. Students will have to face their classmates and their own personal attitudes and biases.
So case-based learning forces students to deal with both emotional and cognitive situations.
Exactly.
What are the underlying theories upon which this strategy has been developed?
Case-based learning has a long history of use. It was utilized in law school as early as the late 1800s. It is based on the constructivist orientation as it focuses on providing physical experiences that induce cognitive conflict and hence encourage learners to develop new knowledge schemes that are better adapted to experience. It also falls in line with David Merrill's first principles of instruction, which believes that learning is promoted when the learner is engaged in the application of newly acquired knowledge.
This all sounds great. How would I implement this strategy in my classroom?
The first step is to identify specific learning objectives for your students. From that, you will have to write or find a case that highlights those objectives.
What makes a good case?
First, it should be conflict-provoking, with no obvious correct answer. It should force the students to make decisions. Second, it should be balanced with the student's prior knowledge level. It should also have some sort of generality so that this information will be useful again for the students.
Is there anything else you need to prepare prior to class?
You want to map out specific questions, answers, and tangents that you expect will come out during the discussion so that you are prepared for them.
Would you have the students do anything prior to class?
Because we are not directly providing content, it is important for students to come to class with the information beforehand in order to understand the case. This means that they may have to do pre-readings and answer some preliminary questions.
How does class start?
At the start of class, you will introduce the case. There are 5 typical stages of case analysis. What is the situation? What are the possibilities for action? What are the consequences of each? What action, then, should be taken? What general principles and concepts can be extrapolated from these answers?
What does the teacher have to do during the discussion?
The teacher is making note of the key points made throughout the lesson, either on the board or in their head.
In case-based learning, do you only use discussion?
Discussion is a big part of case-based learning, but it is not the only part. Students can be put into groups to work out specific problems. They can also be assigned research in class that will help them put the pieces together.
How do you end the session?
In the last 10 to 15 minutes, there is a debrief of all of the points that were made and agreed upon. This helps the students connect their ideas to the bigger picture.
What is the criteria for successful implementation of this strategy?
The main thing is to have all students participate. There are several ways to successfully implement this. First, arrange the classroom so that the students can see each other. Consider name tags if the students are not familiar with each other. The second crucial part is creating the climate in the classroom to encourage engagement. Get the students comfortable talking to each other through icebreakers. You can also demonstrate in many cases to get them familiar with the process. The type of questions you ask will determine the difficulty of the case, so case-based learning can be adjusted to ease the students into the process.
So is there a learning curve with this strategy?
There are actually 2. The first curve is the process of students going from hesitant to active learning. At first, it is important for the instructor to give softball questions to the students so that they can get used to answering questions and see that they will be respected. Then as the students increase in confidence, the teacher can push them harder by giving them more challenging questions.
Can you give an example of a more challenging question?
An example could be asking the students how they came to the conclusion. This will force students to probe more deeply into where they get their information and opinions.
What is the second learning curve?
The second curve is completing the content goals of the course. The great thing about case-based learning is how it links these 2 learning curves together. The student gains not only proficiency in the subject matter, but also develops skills in problem solving, analyzing, and teamwork.
When would you not use this instructional strategy?
Case-based learning is not always appropriate for introductory level classes. This is because students often need a good deal of background knowledge in order to participate. Time restraints also need to be considered. You might not always have sufficient time to explore a case and reach your objectives.
So why is case-based learning relevant to adult education?
Well, from several studies we know that traditional lectures still remain the dominant form of teaching. In a study at one university economic program, 83% of in-class time was spent lecturing to students. Although it it is important for these students to learn the facts about economics. When these students enter the workforce, much of their job will be in the application of these facts. By designing a program with case-based learning, these students would be able to gain valuable experience while also learning the content.
This sounds so awesome. Where can I find more information about case-based learning?
Check out the resources thread for more information. There are some great papers and videos to watch to show you how you can implement case-based learning in your classroom. Thanks so much for stopping by my booth. Enjoy the rest of the conference.
Now, it is important to talk about how do we shift traditional CBL to online CBL, because online learning is mandatory in the era of COVID-19 and post-COVID-19 era. I think it is nowadays very important for all medical schools to implement blended learning on site and online learning. So we are in urgent need to identify how to conduct CBL electronically using the learning management system. First of all, a case scenario and reading material developed by facilitators, then shared with the students along with date, time of class and platform of choice or institutional learning management system. Case scenario and reading material developed by the facilitators, then they will be sent to the student through email, through the learning management system, and so on. After that, students prepare for the CBL session, which is mandatory in case-based learning. Students should prepare. Okay, and the preparation should be done individually in their homes. Okay, the next step, facilitator and students meet online for electronic CBL class. Okay, facilitator introduce case, then set ground rules, that's to say, assign students leader and a scriber and timekeeper for the students discussion. Okay, and also the facilitator monitors the discussion. After that, students participate actively, share viewpoints and answers. Now, before we reach the end, the facilitator wrap up, sum up the discussion, then give the students online formative or even summative assessment on the same platform or the learning management system like Zoom, WebEx, Blackboard, and so on. Results emailed to students at the end of the session. Characteristics of eCBL. Number one, a case, problem, or inquiry that stimulates and reinforce acquisition of knowledge, skills, attitude. It is a motivator for the session. Okay, number two, self-directed learning before the session. Number three, during the session. Group discussion and the teamwork. Okay, problem solving and critical thinking. Then active facilitator skills of the tutor, of the medical teacher. Number six, technology enhanced learning. It is very important to have good skills on how to use technology to conduct CBL, BBL, and so on. If you can't use the learning management system like Zoom, like WebEx, Microsoft Teams, you can't conduct any activity by e-learning. Then rapidly, we want to differentiate the backgrounds of BBL and CBL. Background of BBL, problem-based learning. Number one, the students come to a session to see problem or clinical case, then brainstorming to explore the case, then go home to start self-directed learning, then return again for the second session of BBL for group discussion and conclusion. Here in BBL, the facilitator role is passive. Okay, background of case-based learning. It starts with, very important, prior reading. Number two, students come to the session or join the online session. They face problem like clinical case, simulated patient, videotapes. After that, discussion between students. Then these discussions may involve learners interview simulated patient with timeouts. Here in CBL, the facilitator is subject expert and participate actively in the session. How can we differentiate between BBL and CBL in deep? CBL is guided inquiry while BBL is open inquiry. CBL, the tutor send the learning objectives to the students prior to the session, while in BBL, the students create the learning objectives in the session. Okay. Number two, pre-reading material in CBL provided prior to the session, while in BBL not provided. For the faculty advanced preparation, of course, the faculty should prepare very well for case-based learning and problem-based learning. And the role of the learner in case-based learning, they are expected to participate and share their knowledge, ask questions, and so on. But their discussion focused and related to the problem or the case scenario, while in BBL, it is more like brainstorming. So share ideas, ask a question, and here in BBL, the students are the driver for the session. Okay, the role of facilitator in CBL, the facilitator is subject expert. So here in CBL, the tutor is the driver for the session, while in BBL, the facilitator is passive. He should be problem expert, but not necessarily subject expert. Okay. In CBL, interaction with faculty is less, while in BBL, there is more interaction with the faculty as the faculty assess students. In BBL, assess the communication with the students, assess the level of discussion, and so on. Then in CBL, clinical skills will be learned, while in BBL, problem solving will be learned to acquire the basic foundational knowledge. It's not necessary to be clinical skills. Sometimes we use clinical scenarios to motivate students for acquiring foundational knowledge in BBL. Post-session work in CBL less, while in BBL more, including work without benefit, because some readings in BBL will be unfocused tangents. Learning curiosity, of course, in CBL, no curiosity, while in BBL there is curiosity in their trial to solve the problem. Okay. In CBL, assessment of students is less difficult because you will produce a written exam, whatever MCQ, short answer questions, and so on. While in BBL, it is more difficult to evaluate students according to the quality of the discussion. In case-based learning, the self-directed learning is less, while in BBL, it is an open approach, open reading. Some readings may be irrelevant. So in BBL, self-directed learning is more than CBL. Amount of content in case-based learning, there may be one case scenario or many case scenarios. So CBL can cover so many topics, but in BBL, only one scenario will be endorsed during the session. Okay. Regarding the outcome in case-based learning, measured outcomes to see if the objectives are met. It is focused, it is concise to achieve specific objectives. While in BBL, the process of brainstorming, self-directed learning is the outcome. Scientific conclusion, of course, in case-based learning, it is guided by subject expert, so the scientific conclusion will be correct. In BBL, sometimes some scientific conclusion may be false. To wrap up, as a conclusion, CBL was preferred because it is a structured approach. It keeps the learning relevant by providing pre-reading material and enhance clinical skills. There is less busy work. Facilitator participate actively, which is very important in the structure of case-based learning, and lead learners toward learning objectives. While advantages of BBL are they enhance problem solving and self-directed learning. Case-based learning is suitable for students that already have foundational knowledge, while BBL motivates students to acquire the foundation knowledge. These are my references. And at the end, I'd like to thank you all, hoping to have a good experience with traditional and electronic CBL.